Osteopathic medicine, we're looking at things through a different lens. We're not just looking at anatomy, and we're not just looking at physiology. We're looking at those and how they work together. Selena Raines, DO. I'm an osteopathic family physician. I think my interest in just medicine in general came after I joined the Army. And it wasn't until we had done a medical training mission in Bolivia, and I was with a unit that was a different unit than mine, and there were a couple of DOs in that unit, and they were family doctors. They were doing their general medicine thing, but then they were also doing OMT, and I got to witness them doing that. And so big thing that really sparked my interest there was that they just seemed so excited about being physicians and doing medicine in general. When I was ready to apply to medical schools, I just applied to osteopathic schools. I do a lot of OMT in my clinic and in my practice. I always have. From the get-go in osteopathic medical school, I realized the importance of that and how useful it is in the practice of medicine. And so from very early on in first year of medical school, I knew I was going to try to stay and do that additional year in medical school, focusing on nothing but the OMT. And I've just kind of continued to carry that forward. So that's a big passion of mine. And I have a lot of people that come to me specifically for musculoskeletal complaints. Typical day, it really just kind of depends. In my practice now, just kind of who needs me at the time. I've had calls where my eardrum, it feels like it's busted, or swimmer's ear or something like that, to I need you to check out this spot I found on my skin. We'll do OMT just kind of on the fly as well if people have something comes up. But it's typically all of family medicine. I do all of it, with the exception I don't do prenatal or OB care anymore, but I did that previously. The biggest hurdle or frustration that I've had with medicine is not being able to practice 100% the way I wanted to and the way I was taught to. And I think that's everywhere in medicine, probably across all specialties, to be honest. And that is kind of what led me to going the route of direct primary care, because I did see aspects where patients really didn't get the time they deserved. Direct primary care is a fairly newer healthcare delivery model. It's a direct contract between a patient and physician. Most typically, it's a monthly fee that patients will pay to the physician that keeps healthcare affordable for patients. And that fee gets them open access to their doctor. People have a lot of things going on in their lives. The patients, to help work through that, have to have the empathy to really bond with people and be able to kind of help them on their health journey. Had people come in and no one's listened to them before, and if you just take the time to listen to them, a lot of times that's goes just as far for healing for someone as pills and bandages and things. Seeing people, their whole demeanor change, their whole affect change after a visit because you gave them what they needed that day, that is super rewarding, and that's why I do it.